Now let's check out viruses that are more dangerous than the new coronavirus. Spanish flu ranked first in this list. Total confirmed cases are more than 500 million, and total number of deaths are more than 50 million. Spanish flu was originated in year 1918, and its symptoms are chills, fever and fatigue. History. The Spanish flu did not originate in Spain, though news coverage of it did. During World War I, Spain was a neutral country with a free media that covered the outbreak from the start, first reporting on it in Madrid in late May of 1918. Meanwhile, Allied countries and the Central Powers had wartime censors who covered up news of the flu to keep morale high. Because Spanish news sources were the only ones reporting on the flu, many believed it originated there. The Spanish, meanwhile, believed the virus came from France and called it the French flu. The first wave of the 1918 pandemic occurred in the spring and was generally mild. The sick, who experienced such typical flu symptoms as chills, fever and fatigue, usually recovered after several days, and the number of reported deaths was low. However, a second, highly contagious wave of influenza appeared with a vengeance in the fall of that same year. Victims died within hours or days of developing symptoms, their skin turning blue and their lungs filling with fluid that caused them to suffocate. In just 1 year, 1918, the average life expectancy in America plummeted by a dozen years. The Spanish flu pandemic of 1918, the deadliest in history, infected an estimated 500 million people worldwide, about 1/3 of the planet's population, and killed an estimated 20 million to 50 million victims, including some 675,000 Americans. The 1918 flu was first observed in Europe, the United States, and parts of Asia before swiftly spreading around the world. Plague ranked next in this list. Total confirmed cases are more than 600 million, and total number of deaths are more than 50 million. Plague was originated in year mid-1300s, and its symptoms are weakness, fever and headache. History. The third plague pandemic was a major bubonic plague pandemic that began in Yunnan, China, in 1855 during the 5th year of Xianfeng Emperor of the Qing dynasty. This episode of bubonic plague spread to all inhabited continents and ultimately led to more than 12 million deaths in India and China, with about 10 million killed in India alone. According to the World Health Organization, the pandemic was considered active until 1960, when worldwide casualties dropped to 200 per year. Symptoms include fever, weakness and headache. Usually this begins 1 to 7 days after exposure. In the bubonic form there is also swelling of lymph nodes, while in the septicemic form tissues may turn black and die, and in the pneumonia form shortness of breath, cough and chest pain may occur. Globally about 600 cases are reported a year. In 2017 the countries with the most cases include the Democratic Republic of the Congo, Madagascar, and Peru. Plague has historically occurred in large outbreaks, with the best known being the Black Death in the 14th century, which resulted in greater than 50 million dead. Plague has a long history as a biological weapon. Historical accounts from ancient China and medieval Europe detailed the use of infected animal carcasses, such as cows or horses, and human carcasses. Cholera, that is, HAIZA, ranked next in this list. Total confirmed cases are more than 50 million, and total number of deaths are more than 4 million. HAIZA was originated in year 1817, and its symptoms are diarrhea and dehydration. History. HAIZA is an infection of the small intestine by some strains of the bacterium Vibrio. Symptoms may range from none to mild to severe. The classic symptom is large amounts of watery diarrhea that lasts a few days. Vomiting and muscle cramps may also occur. Diarrhea can be so severe that it leads within hours to severe dehydration and electrolyte imbalance. This may result in sunken eyes, cold skin, decreased skin elasticity, and wrinkling of the hands and feet. Dehydration can cause the skin to turn bluish. Symptoms start 2 hours to 5 days after exposure. Prevention methods against HAIZA include improved sanitation and access to clean water. HAIZA vaccines that are given by mouth provide reasonable protection for about 6 months. They have the added benefit of protecting against another type of diarrhea caused by E. coli. The primary treatment is oral rehydration therapy, the replacement of fluids with slightly sweet and salty solutions. Rice-based solutions are preferred. Zinc supplementation is useful in children. In severe cases, intravenous fluids, such as Ringer's lactate, may be required, and antibiotics may be beneficial. Testing to see which antibiotic the HAIZA is susceptible to can help guide the choice. HAIZA affects an estimated 3 to 5 million people worldwide and causes 28,800 to 130,000 deaths a year. Although it is classified as a pandemic as of 2010, it is rare in the developed world. Children are mostly affected. HAIZA occurs as both outbreaks and chronically in certain areas. Areas with an ongoing risk of disease include Africa and Southeast Asia. The risk of death among those affected is usually less than 5%, but may be as high as 50%. No access to treatment results in a higher death rate. Descriptions of HAIZA are found as early as the 5th century BC in Sanskrit. The study of HAIZA in England by John Snow between 1849 and 1854 led to significant advances in the field of epidemiology. 7 large outbreaks have occurred over the last 200 years, with millions of deaths. Marburg virus ranked next in this list. Total confirmed cases are more than 20 millions, and total number of deaths are more than 3 millions. Marburg virus was originated in year 1967, and its symptoms are fever, chills, headache and muscle aches. History. Marburg virus disease, MVD, formerly known as Marburg hemorrhagic fever, is a severe, often fatal illness in humans. The Marburg virus causes severe viral hemorrhagic fever in humans. The average MVD case fatality rate is around 50%. Case fatality rates have varied from 24% to 88% in past outbreaks, depending on virus strain and case management. Marburg virus disease was initially detected in 1967, after simultaneous outbreaks in Marburg and Frankfurt in Germany, and in Belgrade, Serbia. The incubation period, interval from infection to onset of symptoms, varies from 2 to 21 days. Illness caused by Marburg virus begins abruptly, with high fever, severe headache, and severe malaise. Muscle aches and pains are a common feature. Severe watery diarrhea, abdominal pain, and cramping, nausea and vomiting can begin on the 3rd day. Diarrhea can persist for a week. The appearance of patients at this phase has been described as showing ghost-like drawn features, deep-set eyes, expressionless faces, and extreme lethargy. In the 1967 European outbreak, non-itchy rash was a feature noted in most patients, between 2 and 7 days after onset of symptoms. Early supportive care with rehydration, symptomatic treatment improves survival. There is as yet no licensed treatment proven to neutralize the virus, but a range of blood products, immune therapies and drug therapies are currently under development. Influenza, the killer flu, ranked next in this list. Total confirmed cases are more than 700 millions, and total number of deaths are more than 55 millions. Influenza was originated in year 1580, and its symptoms are fever over 100.4 F, 38 C, aching muscles, chills and sweats, headache, dry, persistent cough, fatigue and weakness, nasal congestion and sore throat. History. The 1580 pandemic was the first documented outbreak, in which we can be reasonably sure it was caused by the influenza virus. During the summer of 1580, influenza was reported in Asia Minor and northern Africa. Italian accounts suggest that it spread from Malta to Sicily in July 1580, and subsequently diffused north through the Italian peninsula by August. During that time, Philippi ruled the Iberian Peninsula, southern Italy, and several North African ports. The early July outbreak in the Spanish Netherlands was most likely caused by troops sent by Philippi to fight the Dutch. Influenza spreads around the world in yearly outbreaks, resulting in about 3 to 5 million cases of severe illness and about 290,000 to 650,000 deaths. About 20% of unvaccinated children and 10% of unvaccinated adults are infected each year. In the northern and southern parts of the world, outbreaks occur mainly in the winter, while around the equator, outbreaks may occur at any time of the year. Death occurs mostly in high-risk groups: the young, the old, and those with other health problems. Larger outbreaks known as pandemics are less frequent. In the 20th century, 3 influenza pandemics occurred: Asian influenza in 1957, 2 million deaths, and Hong Kong influenza in 1968, 1 million deaths. The World Health Organization declared an outbreak of a new type of influenza H1N1 to be a pandemic in June 2009. Influenza may also affect other animals, including pigs, horses, and birds. The most common symptoms include high fever, runny nose, sore throat, muscle and joint pain, headache, coughing, and feeling tired. These symptoms typically begin 2 days after exposure to the virus, and most last less than a week. The cough, however, may last for more than 2 weeks. In children, there may be diarrhea and vomiting, but these are not common in adults. Diarrhea and vomiting occur more commonly in gastroenteritis, which is an unrelated disease and sometimes inaccurately referred to as stomach flu or the 24-hour flu. Complications of influenza may include viral pneumonia, secondary bacterial pneumonia, sinus infections, and worsening of previous health problems, such as asthma or heart failure. Types of influenza virus. In virus classification, influenza viruses are RNA viruses that make up 4 of the 7 genera of the family Orthomyxoviridae. Influenza virus A, influenza virus B, influenza virus C, influenza virus D. These viruses are only distantly related to the human parainfluenza viruses, which are RNA viruses belonging to the paramyxovirus family that are a common cause of respiratory infections in children such as croup, but can also cause a disease similar to influenza in adults. The 4th family of influenza viruses, influenza D, was identified in 2016. The type species for this family is influenza D virus, which was first isolated in 2011. Influenza virus A. This genus is one species, influenza A virus. Wild aquatic birds are the natural hosts for a large variety of influenza A. Occasionally, viruses are transmitted to other species and may then cause devastating outbreaks in domestic poultry or give rise to human influenza pandemics. The influenza A virus can be subdivided into different serotypes based on the antibody response to these viruses. The serotypes that have been confirmed in humans are H1N1, which caused swine flu in 2009, H2N2, which caused Asian flu in 1957, H3N2, which caused Hong Kong flu in 1968, H5N1, which caused bird flu in 2004, H7N7, which has unusual zoonotic potential, H1N2, endemic in humans, pigs and birds, H9N2, H7N2, H7N3, H10D7, H7N9, rated in 2018 as having the greatest pandemic potential among the type A subtypes, H6N1, which only infected one person who recovered. Influenza virus B. This genus is one species, influenza B virus. Influenza B almost exclusively infects humans and is less common than influenza A. The only other animals known to be susceptible to influenza B infection are seals and ferrets. This type of influenza mutates at a rate 2 to 3 times slower than type A and consequently is less genetically diverse, with only one influenza B serotype. As a result of this lack of antigenic diversity, a degree of immunity to influenza B is usually acquired at an early age. However, influenza B mutates enough that lasting immunity is not possible. This reduced rate of antigenic change, combined with its limited host range, inhibiting cross-species antigenic shift, ensures that pandemics of influenza B do not occur. Influenza virus C. This genus is one species, influenza C virus, which infects humans, dogs and pigs, sometimes causing both severe illness and local epidemics. However, influenza C is less common than the other types, and usually only causes mild disease in children. Influenza virus D. This genus is only one species, influenza D virus, which infects pigs and cattle. The virus has the potential to infect humans, although no such cases have been observed. HIV human immunodeficiency virus, ranked next in this list. Total confirmed cases are more than 80 millions, and total number of deaths are more than 3.2 millions. HIV was originated in year 1920, and its symptoms are fever, chills, rash, night sweats, muscle aches, sore throat, fatigue, swollen lymph nodes, mouth ulcers. History. HIV continues to be a major global public health issue, having claimed more than 32 million lives so far. However, with increasing access to effective HIV prevention, diagnosis, treatment and care, including for opportunistic infections, HIV infection has become a manageable chronic health condition, enabling people living with HIV to lead long and healthy lives. There were approximately 37.9 million people living with HIV at the end of 2018. As a result of concerted international efforts to respond to HIV, coverage of services has been steadily increasing. In 2018, 62% of adults and 54% of children living with HIV in low and middle income countries were receiving lifelong antiretroviral therapy, ART. A great majority, 82%, of pregnant and breastfeeding women living with HIV also received ART, which not only protects their health, but also ensures prevention of HIV transmission to their newborns. Key populations include men who have sex with men, people who inject drugs, people in prisons and other closed settings, sex workers and their clients, and transgender people. HIV causes AIDS and interferes with the body's ability to fight infections. The virus can be transmitted through contact with infected blood, semen or vaginal fluids. Within a few weeks of HIV infection, flu-like symptoms such as fever, sore throat and fatigue can occur. Then the disease is usually asymptomatic until it progresses to AIDS. AIDS symptoms include weight loss, fever or night sweats, fatigue and recurrent infections. No cure exists for AIDS, but strict adherence to antiretroviral regimens, ARVs, can dramatically slow the disease's progress as well as prevent secondary infections and complications. Hepatitis ranked next in this list. Total confirmed cases are more than 590 millions, and total number of deaths are more than 35 millions. HIV was originated in year 1965, and its symptoms are dark urine, pale stool, abdominal pain, loss of appetite, unexplained weight loss, yellow skin and eyes, which may be signs of jaundice. History. Hepatitis is inflammation of the liver tissue. Some people with hepatitis have no symptoms, whereas others develop yellow discoloration of the skin and whites of the eyes, jaundice, poor appetite, vomiting, tiredness, abdominal pain, and diarrhea. Hepatitis is acute if it resolves within 6 months, and chronic if it lasts longer than 6 months. Acute hepatitis can resolve on its own, progress to chronic hepatitis, or, rarely, result in acute liver failure. Chronic hepatitis may progress to scarring of the liver, cirrhosis, liver failure, and liver cancer. Hepatitis is most commonly caused by the viruses hepatitis A, B, C, D, and E. Other causes include heavy alcohol use, certain medications, toxins, other infections, autoimmune diseases, and non-alcoholic steatohepatitis, NASH. Hepatitis A and E are mainly spread by contaminated food and water. Hepatitis B is mainly sexually transmitted, but may also be passed from mother to baby during pregnancy or childbirth, and spread through infected blood. Hepatitis C is commonly spread through infected blood, such as may occur during needle sharing by intravenous drug users. Hepatitis D can only infect people already infected with hepatitis B. Worldwide in 2015, hepatitis A occurred in about 114 million people, chronic hepatitis B affected about 343 million people, and chronic hepatitis C about 142 million people. In the United States, NASH affects about 11 million people, and alcoholic hepatitis affects about 5 million people. Hepatitis results in more than 1 million deaths a year, most of which occur indirectly from liver scarring or liver cancer. In the United States, hepatitis A is estimated to occur in about 2,500 people a year, and results in about 75 deaths. Hepatitis A. A highly contagious liver infection caused by the hepatitis A virus. Hepatitis A is preventable by vaccine. It spreads from contaminated food or water or contact with someone who is infected. Symptoms include fatigue, nausea, abdominal pain, loss of appetite and low-grade fever. The condition clears up on its own in 1 or 2 months. Rest and adequate hydration can help. Hepatitis B. A serious liver infection caused by the hepatitis B virus that's easily preventable by vaccine. This disease is most commonly spread by exposure to infected bodily fluids. Symptoms are variable and include yellowing of the eyes, abdominal pain and dark urine. Some people, particularly children, don't experience any symptoms. In chronic cases, liver failure, cancer or scarring can occur. The condition often clears up on its own. Chronic cases require medication and possibly a liver transplant. Hepatitis C. An infection caused by a virus that attacks the liver and leads to inflammation. The virus is spread by contact with contaminated blood, for example, from sharing needles, or from unsterile tattoo equipment. Most people have no symptoms. Those who do develop symptoms may have fatigue, nausea, loss of appetite and yellowing of the eyes and skin. Hepatitis C is treated with antiviral medication. In some people, newer medicines can eradicate the virus. Hepatitis D. A serious liver disease caused by infection with the hepatitis D virus. Hepatitis D only occurs amongst people who are infected with the hepatitis B virus. Transmission requires contact with infectious blood. At-risk populations include intravenous drug abusers and men who have sex with men. Symptoms include abdominal pain, nausea and fatigue. There are few treatments specifically for hepatitis D, although different regimes may be tried. Management also focuses on supportive care. Hepatitis E, a liver disease caused by the hepatitis E virus. The hepatitis E virus is mainly transmitted through drinking water contaminated with fecal matter. Symptoms include jaundice, lack of appetite and nausea. In rare cases, it may progress to acute liver failure. Hepatitis E usually resolves on its own within 4 to 6 weeks. Treatment focuses on supportive care, rehydration and rest. Smallpox ranked next in this list. Total confirmed cases are more than 28 millions, and total number of deaths are more than 6 millions. Smallpox was originated in year 1157 BC, and its symptoms are pain areas in the back of muscles, skin, rashes, small bump, blister, scab, or scar, whole body, fever, malaise, or chills, also common, headache or vomiting. History. The history of smallpox extends into prehistory, with the disease probably emerging in human populations about 10,000 BC, and is thought to have originated in India or Egypt at least 3,000 years ago. The earliest evidence for the disease comes from the Egyptian pharaoh Ramses V, who died in 1157 BC. His mummified remains show telltale pockmarks on his skin. Smallpox has had a major impact on world history, not least because indigenous populations of regions where smallpox was non-native, such as the Americas and Australia, were rapidly decimated and weakened by smallpox, along with other introduced diseases, during periods of initial foreign contact, which helped pave the way for conquest and colonization. The disease historically occurred in outbreaks. In 18th century Europe, it is estimated 4 lakhs people per year died from the disease, and 1/3 of the cases resulted in blindness. These deaths included 6 monarchs. Smallpox is estimated to have killed up to 300 million people in the 20th century and around 500 million people in the last 100 years of its existence. As recently as 1967, 15 million cases occurred a year. The initial symptoms of the disease included fever and vomiting. This was followed by formation of sores in the mouth and a skin rash. Over a number of days, the skin rash turned into characteristic fluid-filled bumps with a dent in the center. The bumps then scabbed over and fell off, leaving scars. The disease was spread between people via contaminated objects. Prevention was primarily by the smallpox vaccine. Once the disease had developed, certain antiviral medication may have helped. Smallpox is one of 2 infectious diseases to have been eradicated, the other being rinderpest in 2011. Coronavirus, COVID-19, ranked next in this list. Total confirmed cases are more than 10 million as of the 27th of June 2020, and total number of deaths are more than 0.5 million as of the 27th of June 2020. Coronavirus, COVID-19, was originated in year 2019, and its most common symptoms are fever, dry cough, tiredness. Less common symptoms are aches and pains, sore throat, diarrhea, loss of taste or smell, a rash on a skin, or discoloration of fingers or toes. Serious symptoms are difficulty breathing or shortness of breath, chest pain or pressure, loss of speech or movement. What is a coronavirus? Coronaviruses are a large family of viruses that are known to cause illness ranging from the common cold to more severe diseases, such as Middle East Respiratory Syndrome, MERS, and Severe Acute Respiratory Syndrome, SARS. History. The COVID-19 pandemic, also known as the coronavirus pandemic, is an ongoing global pandemic of coronavirus disease 2019, COVID-19, caused by Severe Acute Respiratory Syndrome Coronavirus 2, SARS-CoV-2. The outbreak was first identified in Wuhan, China, in December 2019. The World Health Organization declared the outbreak a public health emergency of international concern on the 30th of January 2020, and a pandemic on the 11th of March. As of the 26th of June 2020, more than 9.6 million cases of COVID-19 have been reported in more than 188 countries and territories, resulting in more than 5 lakhs deaths. More than 4.8 million people have recovered. The virus is primarily spread between people during close contact, most often via small droplets produced by coughing, sneezing, and talking. The droplets usually fall to the ground or onto surfaces rather than traveling through air over long distances. However, research as of June 2020 has shown that speech-generated droplets may remain airborne for tens of minutes. Less commonly, People may become infected by touching a contaminated surface and then touching their face. It is most contagious during the first 3 days after the onset of symptoms, although spread is possible before symptoms appear and from people who do not show symptoms. Common symptoms include fever, cough, fatigue, shortness of breath, and loss of sense of smell. Complications may include pneumonia and acute respiratory distress syndrome. The time from exposure to onset of symptoms is typically around 5 days but may range from 2 to 14 days. There is no known vaccine or specific antiviral treatment. Primary treatment is symptomatic and supportive therapy.